Welcome back to our channel, where we bring you the latest information on health and well-being. Today, we're going to dive into the world of medical testing and discuss some of the most important tests that you should be aware of. These tests play a crucial role in diagnosing various conditions and diseases, helping doctors make accurate assessments and providing vital information for treatment options. So, let's get started with our list of 20 important medical tests. Point 1. Blood pressure test. First up, we have the blood pressure test. This test measures the force exerted by the blood against the walls of your arteries and helps detect hypertension or low blood pressure. Point 2. Complete blood count, CBC. The complete blood count, or CBC, is a common test that evaluates various components of your blood, such as red and white blood cells, hemoglobin, and platelets. It provides valuable insights into your overall health and helps diagnose conditions like anemia and infections. Point 3. Cholesterol test. The cholesterol test measures the levels of cholesterol and triglycerides in your blood. High cholesterol levels can increase the risk of heart disease, so this test is essential for assessing your cardiovascular health. Point 4. Fasting blood glucose test. The fasting blood glucose test measures your blood sugar levels after a period of fasting. It helps in diagnosing diabetes or prediabetes and is a crucial test for managing your blood sugar levels. Point 5. Electrocardiogram, ECG. An electrocardiogram, or ECG, records the electrical activity of your heart. It is a non-invasive test that helps identify irregular heart rhythms, heart attacks, and other heart-related conditions. Point 6. Pap smear. The Pap smear is a screening test primarily for women that helps detect abnormalities in cervical cells, including cervical cancer. It is an important tool for early detection and prevention. Point 7. Mammogram. A mammogram is an X-ray of the breast that aids in the early detection of breast cancer. Women over the age of 40 should regularly undergo mammograms to ensure early diagnosis and improved treatment outcomes. Point 8. Colonoscopy. Colonoscopy is a procedure that examines the colon for any abnormalities, such as polyps or signs of colorectal cancer. It is recommended for individuals over the age of 50 to screen for colon cancer. Point 9. Bone density test. A bone density test, also known as a DEXA scan, measures the strength and density of your bones. It is crucial in diagnosing osteoporosis and evaluating your risk of fractures. Point 10. Pulmonary function test, PFT. The pulmonary function test assesses lung function, measuring parameters such as lung capacity and airflow. It helps diagnose respiratory conditions like asthma, chronic obstructive pulmonary disease, COPD, and pulmonary fibrosis. Point 11. Magnetic resonance imaging, MRI. An MRI is a diagnostic imaging technique that uses strong magnetic fields and radio waves to create detailed images of the body. It provides valuable information about various organs and structures, aiding in the diagnosis of conditions like tumors, injuries, and neurological disorders. Point 12. Computed tomography, CT, scan. A CT scan is another imaging technique that uses X-rays to produce cross-sectional images of the body. It is particularly useful for identifying conditions in the chest, abdomen, and pelvis, such as tumors or internal injuries. Point 13. Urinalysis. Urinalysis involves examining a urine sample for various markers, such as the presence of blood, protein, or glucose. It helps detect urinary tract infections, kidney diseases, and other conditions affecting the urinary system. Point 14. Liver function test. The liver function test evaluates the health of your liver by measuring the levels of enzymes, proteins, and bilirubin in your blood. It helps diagnose liver diseases such as hepatitis, cirrhosis, and fatty liver. Point 15. Thyroid function test. The thyroid function test measures the levels of thyroid hormones in your blood, including TSH, T3, and T4. It helps assess the functioning of your thyroid gland and diagnose conditions like hypothyroidism or hyperthyroidism. Point 16. Prostate-Specific Antigen (PSA) Test. The PSA test is a blood test primarily used to screen for prostate cancer in men. It measures the levels of PSA, a protein produced by the prostate gland. Elevated levels of PSA may indicate the presence of prostate cancer or other prostate conditions. Point 17. Genetic testing. Genetic testing involves analyzing your DNA to identify any genetic mutations or variations that may be associated with certain diseases or conditions. It can help determine your risk of developing genetic disorders or assist in personalized treatment approaches. Point 18. Allergy testing. Allergy testing helps identify specific allergens that trigger allergic reactions in individuals. It can be done through skin tests or blood tests and plays a crucial role in diagnosing and managing allergies. Point 19. HIV Test. The HIV test detects the presence of antibodies or antigens related to the human immunodeficiency virus, HIV. It is essential for early detection and diagnosis of HIV infection, allowing for timely medical interventions and prevention of transmission. Point 20. Sleep study, polysomnography. A sleep study, also known as polysomnography, is a comprehensive test that monitors various aspects of your sleep, including brain waves, heart rate, breathing patterns, and oxygen levels. It helps diagnose sleep disorders such as sleep apnea, narcolepsy, and insomnia. And that concludes our list of 20 important medical tests that you should be aware of. Remember, these tests are vital for early detection, diagnosis, and management of various diseases and conditions. If you have any concerns or symptoms, always consult with your healthcare provider who can guide you on which tests are appropriate for you. Stay informed, take care of your health, and thank you for watching. Don't forget to subscribe to our channel for more informative content.